of stress. They feel, sometimes in our society, and it's not always the case, but sometimes men feel like they need to be the one that are taking on a lot of the responsibility as far as, making sure that they're bringing in funds, to support their family, funds to provide. Also, a lot of times, sometimes the jobs they can take can be stressful too. I know women have a lot of stressful jobs too and also provide for their families too. But I think a lot of times men, due to the social norms, they feel that somehow that's their responsibility. That can bring a lot of stress, and when you have a lot of stress, that can raise cortisol levels, and cortisol levels can just completely wreck your physical health, as well as effects it has on your mental health too.
We want to pay attention when we're young, and we want to adapt when we get older. The main focus is setting that foundation early, but if we're already in our 50s and we don't have these habits going into it, now's the time to start. So making small changes today, being proactive, listening to your body, and seeking professional help is the best way to stay healthy.
I think one of the biggest barriers when it comes to men's mental health is that they don't usually seek out help for that. In our society, I think sometimes reaching out for help can be looked at as weakness, and it's not. Actually, it's one of the most brave things you can do. And for everyone, including men, getting mental health help carries a stigma, and also stigma, from what I've seen, and there's a lot of data to back it up too, stigma is one of the biggest barriers for folks getting the help they need and getting healthy and getting better. Reaching out and getting help is actually really brave. It actually allows you to actually be there and provide for those loved ones, because if you're not taking care of yourself, you can't take care of others.
It gets overlooked by men way too often that we don't talk about the stressors that we have in life. And that doesn't mean that it always has to be in a professional setting. Some people can find hobbies, exercise, meditation, social outings, having a friend to kind of talk to, but don't feel worried about reaching out to a medical professional.
It's okay to talk about things. Even if it's through a friend, there's lots of other ways you can reach out for support.
We gotta be proactive about these issues. Now's the time to get ahead. First, let's start with under 50. So we need to make sure that we're aware that we're gonna be going through some hormonal shifts, and that's not just from the testosterone side, that's going from our cortisol because we're having lifestyle changes. We might be getting a job, going through college, starting a family, all that kind of stuff results in more responsibility. So the key is to build a foundation for the future. First, we wanna focus on the exercise. So when I say exercise, it's not just strength training, it's strength training and cardio. This focuses on our muscle health, improving our hormone production, and then building our heart health. So first, our weights, we're gonna be building up our bone strength, supporting our metabolism, releasing hormones, and then building up our joint health. For cardio, we're gonna be doing improvements to blood pressure, improving lung capacity, and building endurance. The key is doing a mix of these two things to make sure that we're getting all our P's and Q's in a row.
So our physical health affects our mental health. It really does. So even getting outside and going on a walk can have major positive effects on our mental health. Being out in nature, exercise, and it also reduces cortisol levels too. It makes you be less prone to stress.
If we're going outside, wear some sunscreen. We want to make sure we're doing routine checkups. We're checking for cancer if we have a family history or anything, your blood pressure, cholesterol, glucose, and hormones. These should be with your doctor, regular checkups where you're going. Make sure you get a blood test and get ahead of any issues that you might see coming. Also with self-checks, we want to make sure if we see any lumps or anything that seems different, checking our skin often. If there's some discoloration or anything, make sure to get it checked out.
A lot of times with men, as we get older, in age, and this is normal, and sometimes we feel like it's not, but it actually is, as our testosterone tends to decrease.
Things start changing. We'll have lower testosterone levels, we'll have higher estrogen, we'll typically have more cortisol,
which can cause some changes, with our bodies. We store fat a little bit and start storing more fat differently. It can affect, our energy level.
Our immunity function gets a little bit worse, and our likelihood of cancer starts to go up.
That can lead to us feeling maybe depressed at times too.
When we age, we start losing our muscle mass.
That affects our mental health too, because when you have those changes, that can affect how you feel about yourself, or maybe how you feel if you have lower energy. It can make you not want to do some of the things that you like to do.
We also lose range of motion.
Understanding that and then learning what things you can do to help kind of counteract that sometimes, that can be very beneficial to your mental health.
You're more prone to heart conditions, chronic conditions. Hypertension, heart disease, and diabetes are the most common when we get over the age of 50. Now, what we can do is start doing some low impact exercises like swimming and walking and body weight exercises. We want to make sure that we're stretching both dynamically and static stretching. That can be before exercise, after exercise, or first thing when you wake up or before bed.
Regular sleep's really important. There's not necessarily a set amount of sleep. What may be enough sleep for someone may be too much sleep for someone else. And so you can talk with your doctor.
Sleep and recovery declines when we get older. For some reason, we have more difficulties falling asleep. This impacts our hormones as well. The strength training can help release testosterone and growth hormone. But if your sleep's not there, your body's not given the chance to release those hormones. So we want to make sure that we're sleeping enough. Stick with your regular screenings, getting your blood test. And then on the nutrition side, we want to lower our sodium. We want to stay within a healthy weight and continue doing some type of physical activity.
Having feelings is okay, and it's okay to ask for help, and it's okay to talk about your feelings. It's okay to reach out for help. That's one of the strongest things you can do. It's one of the bravest things you can do. It's okay to reach out. Please do it.